Today I'm going to share with you some information about the care of children post-cardiac catheterization. Cardiac catheterization has become a rather routine procedure, but there are some complications. The complications include hemorrhage from the insertion site, low-grade fever, nausea and vomiting, loss of pulse in the cath extremity, and transient dysrhythmias. With good assessment post-catheterization, we can detect these complications early and save the patient from further harm. Post-cardiac catheterization, the child will need to keep the extremity where the entry site was straight for 4 to 6 hours to decrease the chance of complications. This can be accomplished with bed rests for older children, or younger children can be held by their parents to keep that extremity straight. In addition, sometimes children need to stay overnight for observation if they have had more extensive procedures done and will need some monitoring. Children often go to the post-anesthesia care unit for monitoring if they are going to be going home later on after the procedure. Nursing assessment post-catheterization includes the following: checking the pulses, especially below the catheter site for equality and symmetry. The pulse distal to the site may be weaker for the first few hours, but it should gradually increase in strength. The nurse needs to check the temperature and color of the affected extremity, since coolness or blanching may indicate arterial obstruction. Vital signs should be checked per institution policy and may be checked as often as every 15 minutes. The heart rate should be counted for a full minute to adequately assess for bradycardia or dysrhythmias. The blood pressure needs to be checked, especially to check for hypotension, which may indicate hemorrhage from cardiac perforation or bleeding at the site of catheterization. The nurse also needs to check the dressing for evidence of bleeding or hematoma formation at the catheter entry site. For children, this is usually the right femoral artery. Fluid intake, both IV and oral, needs to be monitored to make sure that the child is adequately hydrated. Blood loss in the cath lab and the child being NPO prior to the procedure, as well as diuretic actions of the contrast material used during the procedure, put the child at risk for dehydration. Infants in particular are at risk for hypoglycemia as well, and they should receive IV fluids with dextrose, and blood sugar should be monitored. As I stated earlier, many children come in to have their cardiac catheterization done on an outpatient basis and are discharged later the same day. So it's important to provide the parents with good discharge instructions so that they can monitor the child for any complications. Pain management with Tylenol or ibuprofen is usually ordered. We want to instruct the parents to keep the occlusive dressing on until the next day, and then they are able to place a Band-Aid over this site each day for 2 additional days. We want them to keep the site clean and dry, so that means no tub baths for at least 3 days, and if it's summertime, you want to instruct them not to allow the child to go swimming. We want to show the parents how to check the site for redness, swelling, draining, and bleeding, and to call the doctor if they notice any of these things, as well as monitoring the child for a fever. We want the parents to check the leg for coolness as well, as that would indicate that there is decreased circulation in the extremity. Most children should be able to resume normal activities following a cardiac catheterization, but they should not participate in any strenuous exercise. They are, however, able to go to school. They should resume their diet as tolerated. They should follow the doctor's instructions for pain control, and they should attend any follow-up appointments that have been scheduled for them. So to summarize, in this instructional video, we have reviewed the nursing post-catheterization assessments that need to be done, and we have reviewed the discharge instructions for parents post-cardiac catheterization. I hope that you have found this instructional video helpful as you begin caring for children with cardiac defects.